Well, if you find you have swollen, red, or tender gums, you could have a common infection called periodontal disease.
The good thing is that it can be fairly preventable, but if you do get it, what are the next steps from here?
Well, here to tell us more are dental hygienist Bethany Schmidt and Mara Keir of Quality Dental Care. Good to see both of you.
Welcome.
Thank you.
Periodontal disease, it affects a lot of people. It can. Explain what it is. Can you break that down for us?
Yeah, so periodontal disease, basically what it is, it's an infection of the gums, bone, and ligaments that surround the teeth. And it's actually the leading cause of adult tooth loss, so that's why it's so important to get taken care of. The main cause of periodontal disease is going to be the accumulation of plaque on your teeth. That's made up of like a sticky film of food and bacteria, and it's constantly forming on our teeth.
Now, what other effects does periodontal disease have on the body?
Yeah. It's going to affect the gums, particularly red swollen gums, kind of like Mike said. You'll have gums that kind of pull away from your teeth. You could have bleeding when you brush or floss, or loose teeth, or even bad breath. But a lot of people that have periodontal disease will maybe not even have any symptoms, so that's why it's really important to go in regularly for your cleanings and checkups.
We're looking at the tooth here, and the gums come out. You can see they're kind of swollen. Explain what we're looking at.
Yeah, so all of that kind of tartar, that yellow that's wrapping around the tooth, that's that tartar, and that's a buildup of plaque and bacteria over time.
And now she's gone.
Yep, and it gets loose and it falls
the tooth
out.
Is gone.
Exactly, exactly. So the bone's kind of dwindling away, as you can see, and that's the loss of support.
Yeah.
Yeah, well, that does not look good, does it?
No,
not at all.
No.
So tell us about, let's see, the risk factors. Who's at risk for this?
Some risk factors include smoking, patients with diabetes. Periodontal disease tends to make your blood sugar increase, making diabetic complications very common. Poor nutrition, poor oral hygiene, people who aren't brushing their teeth twice daily or flossing or disrupting the bacteria, they're going to be more at risk for this infection.
You got to get rid of that bacteria, right? Flossing is critical, mouthwash, brushing your teeth. And there are different phases of periodontal disease, but when it comes to the treatment, after diagnosis, how do you progress from there? How do you treat it?
So the first step for treatment is called scaling and root cleaning. Oftentimes we call it a deeper cleaning. We get you numb so that way you're not uncomfortable, and we get down below the gums and clean out all that tartar and that infection causing bacteria. We also then perform a periodontal laser therapy, which actually sterilizes those pockets and reduces healing, reduces postoperative pain, as well as increasing healing results.
Who should get it? Like, at what stage during periodontal disease are you a good candidate for that?
Well, the sooner the better. There's going to be different stages in the disease. The first stage is going to be solely with the gums, and that's gingivitis. If we can stop it at that phase, not progress, that would be ideal.
That's what I was going to ask.
That's a lot easier to treat then.
Gingivitis would be the first thing that happens.
Well, if you have gingivitis, the deeper cleaning wouldn't be necessary at that point. We would recommend scaling and root planing once we've lost some bone or the ligaments kind of start to dwindle away.
Right.
That's when scaling and root planing would be necessary.
Okay, so after the procedure's done, what's the next step recommended after this?
We usually recommend 3-month checkup appointments. It only takes about 90 days for that bacteria to reaccumulate below that gum line and start causing damage again. So
90 days.
90
so
days.
You,
90
days.
days.
Have to be proactive.
Yeah, so coming in every 3 months is the safest way to maintain the health of your mouth.
Now, for the average person, is it still recommended that you get your teeth cleaned and checked up about once every 6 months?
Correct.
Would you say?
Yes, absolutely.
Once every 6 months. Okay.
What do you think, like, for general, because we have a lot of viewers out there, some of them may have periodontal disease, a lot of others don't, so they want to prevent it. What are some of the best things you can do, and what are some of the things that people just aren't doing when it comes to dental hygiene?
I bet I can guess.
Making sure you're coming in every 6 months for cleaning.
So twice a year, you want to get into the dentist every
Yes.
6 months.
Minimum.
Flossing. That's why we talked about this. We're not great flossers.
About 3 times a week, maybe.
It's pretty average.
It's better than none, right?
Better than none. I need to floss more.
We're taking a look at some pictures right here.
Yeah. So that first picture is going to be a healthy mouth. No bleeding when you're brushing or flossing, tight gums, nice pink gums. That's ideally what we want your mouth to look like. When you move to the second picture, that's going to be that first phase of gingivitis, mainly for the gums. Yeah. So that's
really different.
These two pictures are going to be the more severe forms of periodontitis or periodontal disease. This is where the bone starts dwindling away. We have red puffy gums. They're definitely bleeding when brushing and flossing. So this is definitely when we would want to do the deeper cleaning and get you on a 3-month recall.
One of the things you said, you touched on bleeding of the gums when you're flossing. If you're seeing blood during floss, it means you're not flossing enough, or is that an indication of bigger problems?
It definitely could be an indication of bigger problems. A lot of people don't actually floss the correct way, so that's another really important reason to come in every 6 months so we can kind of guide you and help you remove the plaque like it should be.
Right.
What are we doing wrong when it comes to flossing? We're just not getting in on
Yep.
both sides of the gum
Yep,
or
it's
the
that
teeth?
scraping motion. So once you're in between the teeth, it's actually scraping up and down each side of the tooth to remove that plaque.
Instead
thoroughly.
of going back and forth, you mean?
Right, and then a lot of
Do you
people
go back
just
and forth on your
I think-
flossing?
Yeah, I go back and forth. Is
You wanna
that
go up
bad?
and
like
down,
the
right?
seesaw, yeah.
I
Yeah,
know
you
it's
want to
seesaw.
kind of scrape each side.
I think
Oh,
of it
well,
as
I'm
like a
flossing wrong.
C-shape. You want to scrape the whole side of that tooth.
Okay, so yeah, I'm definitely doing that.
So
wrong.
pull. I know we're getting way deep into flossing here.
Now
But
everyone knows my flossing
Pull the
habits.
floss around the tooth, and then go up and down, and then
scrape.
pull around the other side and go up and down.
Exactly.
Okay.
exactly.
Okay,
You
I'm
guys
going
got
practice.
it.
I'm
You
going
guys got
practice.
it.